All of the treatments that we do here are science-based. These are therapies that I've been proven to work for many years. Unfortunately, all of them or some of them are not approved in the United States, but in here in Mexico and in Europe, in other countries, there are conventional treatments against cancer.
You've just heard from Dr. Bautista, founder of Immunity Therapy Center, an integrative cancer clinic in Tijuana, Mexico. Over the past 3 decades, he's treated thousands of patients who were told there was nothing else to try. People failed by standard care, who came looking for something different. This conversation isn't just about treatments, it's about what Dr. Bautista has observed after years of working closely with people navigating complex diagnoses. How care is personalized, how emotional readiness and mindset can shape a patient's journey, and what factors he considers when creating a treatment plan. If you're exploring alternative cancer care and want help finding the right fit, speak with one of our advisors. We vetted dozens of clinics and offer a free 5-star rated service to guide you. Visit healnavigator.com. The link is in the description below.
Hi, Dr. Bautista. Thank you for joining us today. I just want to start with your story and what led you to open Immunity Therapy Center in Tijuana.
Hey, good morning. Still morning. Well, it's been a journey. When I started in medicine school, I was always questioning treatments and different things. I had a natural affinity for alternative treatments even back then. I was reading a lot about it even while I was in university. So then when I graduated around the same time, my father was diagnosed with lung cancer. And well, I didn't know better. So he went and had the chemotherapy and radiation and all of that. And he did very, very poorly. He didn't last more than 3 months or so. And that's why I strongly question cancer treatments along with other therapies for many other health issues. But that was one of the main reasons why I decided to go in this direction and take a different path than what you usually do after graduating. I decided not to go the conventional way and dedicate my life to this, and that was one of my main motivations.
I remember you mentioning that to me whenever I was in Tijuana touring your beautiful facility.
Thank you.
It's amazing that that's what inspired your work and that you've been serving for the past, what, now 3 decades?
Yep.
Yeah.
30 years. Wow. It's a long time.
You've worked with so many patients who've come to you after exhausting standard of care. What has treating these cases taught you?
Well, that there are other options, right? Alternative treatments or functional treatments or whatever you want to call them, but they work even if they are not offered in a conventional environment, but mainly that patients have hope even when they are being told that there's nothing else that they can do.
Yeah, I think that's really important. I think that's the key factor with a lot of people during our navigation calls and just inspiring that hope to them and letting them know it doesn't have to be, one way or another. Are there any types of cancers that you particularly will see your approach respond better to?
Well, thank God, usually all type of cancer in all stages respond very well. And if I have to choose one or two, it will be probably lymphomas and breast cancer. Probably those are the two that we've noticed that we have a quick and good response. But all of the different cancers that we treat, we always find a way to make sure that they get better.
Why do you think the breast or the lymphoma generally respond better to your therapies?
Like I mentioned, all of them do well. I don't have any particular reason why those two we notice a little quicker response might be in the situation that they respond better to immunotherapies. That's one of the main treatments that we do here.
Would you like to touch base on the immunotherapy that you do offer on site?
As the name of the hospital is Immunity Therapy Center, we've been doing immunotherapy in cancer even before it was a concept. We always thought that immune system played a very important role on detecting and destroying cancer cells. Later, it was discovered that actually cancer cells are invisible to the immune system. So what we're trying to do is different immunotherapies that are going to make the cancer be recognized by the immune system and give the tools that the immune system needs to be able to destroy cancer cells. One thing is detecting it, and another thing is destroying it. So we do different treatments, particularly to make sure that the cancer is discovered, visible, and that the immune system have the right ways of being able to destroy them. That's why we stimulate particular parts of the immune system, the part that it's in charge of destroying cancer cells.
Is it going to be like dendritic, NK cell, LAK cell? Can you touch on that? Because when people hear like immunotherapy, they're thinking of like, say, Keytruda, these pharmaceutical immunotherapies.
Yeah, let me make sure that we define. There is recently, probably like 10, 15 years ago, that's when immunotherapy started being researched in a conventional way. Basically, what they do, these conventional immunotherapies, they take off the brakes to the immune response, right? So those are the medications that you are referring to, like Keytruda or other type of those type of medications. The type of immunotherapy or alternative immunotherapy, if you want to call it like that, we make sure that we stimulate the whole immune response, right? Keytruda, for example, will have a better response already proven in melanomas and those type of cancers. But the type of immunotherapy that we do where we use all these antibodies that you just mentioned and dendritic cells and the specific transfer factor, I don't like to call them vaccines. They used to call them vaccines, like dendritic cell vaccine, but they're not really a vaccine. They're mostly antibodies, and nowadays vaccine, it will have this negative connotation, but they're not vaccines. But we do use dendritic cells. We do use a specific transfer factor, macrophage activating factors. We have different procedures like the LAK or leukocytes activated by interleukin type 2, MCA, which is a procedure that we do here that is called mononuclear cell activation, which are procedures that are going to stimulate very specifically your immune system and is going to give the proper stimulation for the immune system to be able to recognize and destroy cancer cells. So it's a very complete immunotherapy. But yes, I do want to make sure that we differentiate conventional immunotherapy to the type of immunotherapy that we do here.
I always hear that concern whenever I do speak with people over the phone. They automatically think that the immunotherapy they will be getting is going to be the immunotherapy that's going to be offered through standard of care. And they don't understand that even these types of therapies really can't be obtained here in the United States, that
Mm-hmm.
you often have to travel outside the United States for that.
Yes.
And have you noticed any like common threads in patients who do better than expected?
Normally, the patients that do better than expected are the ones that follow the home program,
Mm,
because when they come in here, they usually stay for 3 to 6 weeks, where we do a very intensive work and treatment, and they usually respond well. But a lot of the work is done or need to be done at home. So when patients leave, we give them a very specific home program to continue with, and the ones that respond the best are the ones that usually stay with the home program for at least like 6 months.
Yeah, and I guess the ones also that would do the return visit too, because it's not just coming to the clinic one time.
Exactly. Depends on each case and depends on the type of cancer. Usually, we request patients to come back between 3 to 6 months, but that's decided depending on each case. Patients that come back on a regular basis have better outcomes. We see that absolutely. And definitely the ones that stay long term with us, coming periodically, where we are able to boost their immune system and do other treatments, definitely do better.
And could you kind of touch on what the home program would look like for people, just in general?
Yes, the home program is customized depending on each patient needs, but
Mm.
usually it's a combination of immunotherapies with devices that we want them to continue with, like RIFE or local hyperthermia, biomagnetic treatments. Usually we combine with some supplementation, but one of the main things that we want patients to continue with will be specific immunotherapies for their type of cancer.
And so you'll actually send them home with those immunotherapies to continue doing?
Yes, yeah. Usually, we prepare very specific antibodies where the specific transfer factors, macrophage activating factors. Usually, those are the type of immunotherapies that we send patients with.
And what do you think matters the most for these people? Is it the timing, the protocols, the emotional readiness that makes the treatment more successful for them overall?
Definitely, they have the right attitude and they believe that these can work for them. It's important. I think coming in time for treatments and going along with other recommendations, definitely that it plays a very important role in the success with a specific case.
And so, what factors help you determine when to use certain treatments and when to hold off?
Not all the therapies are for the same purpose. Each treatment that we do will address different cancer cell weaknesses. So, like oxygen treatments, like heat treatments, and so on. So, they work together. And we try to address those weaknesses so our chances of success are higher. Each therapy will complement for better results.
Thank you for sharing that because I do understand you guys have a long list of modalities used at your facility.
Exactly, but they're for different cancer cell weaknesses. It's not like one will compete with the other for better results. They will address different purposes.
And do you incorporate any repurposed medication at ITC? You know, it's kind of buzzing around fenbendazole, ivermectin, mebendazole. Is that some patients you'll see?
In some cases, we do use repurposed medications like metformin and ivermectin and all these other medications. We need to evaluate how it may have interaction with some of the therapies that we do here, but we do use it sometime. And normally patients already come taking those type of medications, so we don't have any problem with them continuing with it. Sometimes our approach is a little bit different, a little bit more science based.
That's understandable. I just wanted to address that because I get that question all the time is if somebody is on it.
We see that the can have a real benefit from them.
Yeah, I believe it can be one important tool. Could you dive into what it actually is like at Immunity Therapy Center? Like describe what a patient's day would look like there.
Yeah, normally we request patients to come for 3 weeks. Normally, when you come in, we pick you up at the airport, we bring you into the hospital, then you are received here. All the documentation needs to be signed, and then you're seen by your treating doctor. They do the intake. Right after that, you'll meet with me personally, and I will make sure that all the treatments are correct. I review everything. After that, they start treatments. We have the therapy areas in the fourth floor. We have a 7-story building where we have surgery suite. Where we deal with complications. And so after they meet with me, patients go to start their treatment. I usually see all the patients 1 or 2 times a week, but you're seen daily by your treating doctor and you have your nurses assigned. So all the treatments will come to you. And usually we have 2 shifts. We have the morning shift with the patients coming around 8:30 in the morning and they finish the treatment around 2. And we have the afternoon shift where they come in around 1 and they finish between 7 and 8 o'clock at night. So that's how the days go here. We do treatments Monday through Saturday. Usually Sunday is off. And that's how patients do the treatments here.
Do you have like any like emotional wellness support or any nutritional guidance that the patients will receive while there as well?
The nutritional part, yes. We do have our nutritional department. We have our physical therapy department. We do have our dental department as well. Either heavy metals, mercury, if there underlying infection in dental health, it will impact definitely the immune response against cancer. On the emotional side, we do have a counselor. Not all the patients like to do that, to be honest with you. So we do them only with patients that request that type of service. We know that emotional is important, but patients come in with different religions and different beliefs,
Right.
and we do respect that. And only they request something like that, and we accommodate.
Just to kind of touch base on your staff there as well. So, for instance, if someone needed a hematologist, you're able to locate those on site. How does that work?
Oh yeah, we are a full hospital, like I mentioned, and we do have a full licensed specialist here, from surgeons to internal medicine to oncologists to hematologists to urologists, all type of specialists. We have already our team of doctors that work with us. With our patients, they're board certified, and they are the best in town, and we do have all of those services available. Yes.
Since you guys are a full-fledged hospital, you offer inpatient and also the outpatient care. How do those differ?
Well, the outpatient, like the word is describing, they don't stay here. They come in at the respective time, and they go out and they stay either in a hotel, or we do have our own facilities where patients stay. We prefer that they stay with us, to be honest with you, because of
Mhm.
diet and different things. And the inpatient stay here in the building, in our hospital area, and usually those are patients that need intensive medical care, or patients that are not doing that well and they come by themselves. We encourage them to stay with us, so they are supervised by a nurse 24 hours. But all the treatments and therapies are given in their room when they're inpatient. So that's the main difference. Obviously, cost is a little bit more expensive
Mhm.
than the outpatient, but obviously the care is more specialized. And again, those are usually patients that cannot mobilize too much.
Right. They just need more care, essentially, like 24-hour
Exactly.
observation at that point. Yeah.
Yes.
And I know you mentioned that you have your own facilities for the patients to lodge in. Are they apartments that they can stay in?
Yes, we have a total of almost 30 apartments where patients usually stay. We
Mhm.
have shuttles where they take you in and out of the hospital when your treatment is done, and they're very comfortable.
Okay. Do you guys provide meals for them? Do you have like a kitchen on site? How does that work?
We have a nutritional department here. We have
Mhm.
3 nutritionists that will see all of the patients here. Normally, that evaluation happens at the very beginning. We follow a low glycemic index diet, which is a low sugar. As you know, in cancer, that's very important. Some other patients may have very particular requirements, so we try to give what the patient needs. We provide 2 meals a day,
Mhm.
breakfast or lunch and dinner, depending on the shift. And we have our kitchen here with our dining room where we provide those meals, and those are included in the program.
For the type of patients that tend to benefit the most from your approach, would it be newly diagnosed, late stage, or post treatment? Do you see benefit all across the board? What would you say?
We see different all across the board.
Mhm.
Definitely, we like patients to come here without any conventional treatments, but because we do see better response when we start, since they are diagnosed. As you know, well, chemotherapy will definitely suppress the immune response a lot. So in that scenario, usually patients take a little longer to respond, but definitely they benefit all over the board, and we encourage patients to come in any type of cancer, in any type of stage.
And can you just briefly touch on what you just said about patients that have received standard of care like chemotherapy? Because I feel like some people that I talk to, they have the expectation that they're going to go to these facilities and all their cancer is going to be wiped out completely during their first visit. And I try to emphasize that if a patient has gone and done standard of care, then it might need a little bit additional time for their body to play catch up after detoxing and rejuvenate the immune system.
First of all, we want to be very real. We don't want to create false expectations. We are very transparent and clear about what we expect with each patient. Definitely, when you have 10 chemotherapy cycles, conventional high doses, your immune system basically will be wiped out completely for a long time. Unfortunately, that's one of the reasons why cancer recurrence after heavy dose chemo is very high, because you kill the cancer cells, but then you end up with nothing to defend you if cancer cells come back or remain there circulating in your bloodstream.
You mentioned in forms of high doses of chemotherapy. Could you touch on the differences of high doses versus low dose? Because most people don't know that low dose chemo is an option.
We have two modalities of low-dose chemotherapy, DPT or IPT. DPT stands for the MSO potentiation therapy, where the MSO will carry whatever low-dose chemotherapy we want to use, and it will deliver it only to the cancer cells, right? So it makes a very big difference on side effect and toxicity. So we are not affecting any immune response. And we have the other modality where it's called IPT or insulin potentiation therapy, where we lower the glucose to open up glucose receptors in the cancer cells. Then the medication is given along with glucose solution. So then the cancer cell basically will eat the glucose along with the low dose chemo. So we do have those two varieties. We use more the DPT because causing hypoglycemia sometimes can cause problems, and not all of the patients can do that type of therapy. With DPT or the MSO potentiation therapy, there's no side effects, and usually we have very good results.
Do you see that using these integrative methods are beneficial in the long run for patients that have later stage cancers, say stage 3, stage 4?
Yeah, definitely. Most of the time they respond very well. I've been doing this for 30 years plus, so we have enough experience to make sure that patients respond and that they maintain that response, which is very important. Obviously, having the initial response is well, but to make sure that the response endures and they keep in remission is very important.
As I speak to people, when they hear chemotherapy, a lot of times they're very skeptical of it. And they don't know that low dose chemo can be an option and how it can be less harsh on the body and could be very beneficial, especially for those later stage patients.
Exactly. It's really important that they understand that it's effective, but without the side effects or the negativity for conventional chemo dosages.
Is there anything you wish more patients knew before coming to you?
What I would like is for more patients to be know these other options exist. Unfortunately, sometimes patients do not know that these type of treatments are available. Lots of time they go into these conventional treatments and without knowing that there are other options.
What would you say to those who believe integrative therapies are unproven or unsafe?
Well, all of the treatments that we do here, even they are alternative, they are science based. These are therapies that I've been proven to work for many years. Unfortunately, all of them or some of them are not approved in the United States, but in here in Mexico and in Europe, in other countries, there are conventional treatments against cancer. So it's
Right.
not like we are doing something too out of the ordinary if you go and see other cultures.
Yeah, for instance, like hyperthermia and missile.
Yeah, hyperthermia is used conventionally in Europe, in Germany particularly. So, yeah, like that, many treatments are used in other countries, yes.
Are there any treatments that you don't offer at ITC because you feel the evidence isn't strong enough?
Well, if we think in a particular patient that they require a treatment that we don't have available, we usually get it. We have everything available. We have all the resources to do whatever we need to do.
If someone is listening right now and feeling unsure or overwhelmed, what would you want them to know?
Well, that they trust their instinct and they give themselves the opportunity to get better, that there are other options, and that these treatments that we do, they work in late stage cancer. Thankfully, we've been able to help a lot of people. We've been able to put in remission a lot of patients that otherwise were without hope.
Well, thank you, Dr. Bautista, for inspiring that hope and sharing so openly with us. It's been such an enlightening time. So, if this conversation gave you clarity or opened your mind to new questions, we'd love for you to share this episode. If you're exploring your own next step, Heal Navigator is here to help. Visit healnavigator.com. We'll drop the link in the description below.